Hey everyone, welcome back to the show. On a previous video, we talked about a scenario where if you've been told about the treatment options if you're experiencing hair loss, and that there's nothing wrong with saying no to a treatment or to saying actually I don't want to start treatment at all. And so I thought that was really useful, but we're going to unpack that concept a little bit more today and talk about, well, what are some of the reasons why people may not want to start on therapy? Now, a lot of people will have done their research, gone online, read it, etc., and they've heard all sorts of horror stories about starting medication and about the side effects of medication. They go, okay, well, look, these are side effects, they're known to occur. I don't want to take the risk of that, and that's perfectly fine. I respect that decision. But one of the reasons that I hear very commonly is that people don't want to, or certainly are hesitant to start medication because they feel that they are now committed to taking that medication. And I thought it was really important to unpack that concept because I really think there's an important thing to understand there. And it comes back to the cause of hair loss. Now, of course, when we're talking about hair loss, there are a variety of different types of hair loss, but probably the most common one that we experience in clinic is what we call androgenic alopecia. In men, male pattern hair loss; in women, female pattern hair loss. And I want to touch on that specific diagnosis for the time being because I think that's what's most appropriate for most people watching this. So with androgenic alopecia, one of the fundamental things that we have to understand is that, first of all, it's a genetic condition. You can't do anything about your genes, right? You're stuck with those. But the other thing that we really need to appreciate is that for most people, it is a progressive condition. Meaning that if you don't do anything about it now, it's likely, but no one can guarantee, that this time next year, things are going to worsen. All right. Now you are genetically predetermined to lose a certain amount of hair. I get that. That's fine. But if you look at someone as a snapshot today and they've lost a certain amount of hair in the preceding however many months or years, the only thing that you can assume is that potentially they may lose more. All right. There's no guarantee, but there's a chance and probability of that. So that is going to happen regardless. Now, if you take medication, and our medication that we talk about, things like finasteride or minoxidil or dutasteride, medical therapy generally is designed to try and stop the progression of hair loss. It's not going to build up more hair, but it's just trying to stop the progression. So if you start medical therapy and then I see you in a year's time, and you've not lost any more hair, and you go, oh, look, Vikram, I'm looking the same as I was a year ago, I'll be the first one high-fiving you. Because what you've done is you've brought stability to an otherwise unstable condition. Does that make sense? I hope it does. So taking the medication is designed to stop any progression of your hair loss. So if you take that medication for a year and stop the hair loss, that's great. If you stop taking the medication after that year, yes, you're probably going to lose hair. So there's no cure for hair loss. So it's not as if you can take a series of tablets and go, right, that's it, I'm not ever going to lose any more hair. No, your hair loss will only be stable whilst you're taking the medication. Now, that's sometimes a difficult concept for people to understand because most of us, are generally fit and well. Our only exposure to taking medication is, in short bursts. If we've got an infection, for example, we'll take a course of antibiotics for a week. This is different. This is, a long-term sort of treatment that you're trying to stabilize the condition, trying to stop it from getting any worse. And that puts people off because they go, well, I'm now chained to taking that medication. The reality is you're not chained, right? If you want to keep your hair, yes, you're going to have to take that medication long term, but you are absolutely within your right to go, right, okay, I've been on it for X number of months or years, and for whatever reason, I want to stop it. That's perfectly fine. But if you do, yes, you are more than likely potentially going to lose more hair after that. You won't lose more hair than you would have done had you not been taking the medication in the first place, but you will probably regress in terms of your hair count or the amount of hair that you have on your head. So I see that a lot in clinic, that a lot of people go, well, I really don't want to, start on medication because now I'm committed for the rest of my life. And I really want you to stop thinking in that way and go, right, do I want to keep my hair? Because if I want to keep my hair, then this is the option that I at least have to consider. And make sure that when you're doing that, you're speaking to someone who's able to give you appropriate advice. Make sure you see someone who's able to diagnose you properly and give you what the options available to you are in a sort of fair and balanced manner. I hope you found that useful. I know it's a bit sort of esoteric, but I think it's really important because this is something that the discussion that I have almost on a daily basis. So I hope you've, just being able to listen in on that discussion, you've been able to find that useful. All right. Thanks again for watching. We'll see you on the next episode. Take care.